Hello, and welcome to the CommQuest Hope Discovered podcast. Hope Discovered is a podcast series from CommQuest Services. This podcast features individuals in recovery from addiction and mental illness, recovery services professionals, and community advocates who offer insight on how we provide hope to the communities we serve. Today, we will be talking about supporting mothers in recovery. With us is Brooke Burkett, who is a clinical supervising counselor and the Mom and Me Recovery Program Coordinator. We will be talking more about that program and what it is in just a moment. Brooke, welcome to the program.
Hi, thanks for having me.
Absolutely. When we hear about mothers in recovery, especially when they are actually pregnant, it stokes a lot of emotion and can trigger a stigma about women with children when they're in recovery. How do you address that?
I think one of the things that is most helpful for us is we try to have the most non-judgmental attitude towards all of our moms, make them feel accepted, make them know that they're not a bad mom just because they had a history of addiction or are still struggling with addiction. We work very closely with outside sources to make sure that those outside referral sources know that their moms have a hope of being in recovery, being good parents, and continuing to grow in their recovery so that they have support services. And that's one of the best things about the program is it encourages women to stay in the program until their baby is 2. So that encourages them to stay in treatment for at least 2 years.
Sure. I would guess the longer that you stay in recovery, the better your chances are of prolonging it even further.
Absolutely. I mean, the longer we can encourage support services like counseling, the better they have a chance of maintaining that sobriety without relapse. So we want to make sure that we encourage, even if they come once a month to counseling, just as that maintenance.
Sure. In our residential facilities, we also address the issues of mothers who need help with their recovery, as you alluded to. In our women's residential recovery program, for example, mothers can keep small children with them. Can you explain how that works? Is there like some guidelines for that? And I think it kind of speaks for itself in terms of why it is beneficial. You touched on that too, but are there other factors that make that a wonderful thing for mothers?
So yes, we have a residential facility called Deliverance House. It's very open and supportive to all of our moms in need. While they are there, they can take their children with them up to the age of 5. And for a mom who is early in recovery and is scared to leave their child for an extended period of time, I think that's the most beneficial. They have a lot of support there. They're able to take their children so they don't feel like they're abandoning their child. And especially if they're early in recovery and the baby is very new, like newborn, few months, you don't want to leave your child in order to break that bond in recovery. So the fact that they can take the baby with them, they can continue to nurture that bond even while working on their recovery is great. We also have a great partnership with the YWCA, which is really helpful for our moms in recovery who can then focus on the treatment sessions while there, and then baby can go to daycare during the day while they're in treatment.
Right. You mentioned one of our community partners, and I must say, especially in this community, we're very lucky to have some really great community partners. Can you tell us about what some of these partnerships are, like, for example, with hospitals, and how that works?
So we have a really good partnership with Altman Hospital. We have since for the last 3 years. We work directly with their nursing director there to make sure that we are doing safe plans of care with birth plans and sending them directly at least a month prior to the mother giving birth. That way they know what the mom is on as far as medications, what her sobriety date is like. And this does reduce a lot of CPS involvement, especially if the mother is on on a medication-assisted treatment, there's always a lot of questions that come up without those things because they do test positive for them in the hospital. So having those plans ahead of time does help. When we do our partnership with Altman, they come over and do once a quarter and do our luncheon and talk to the ladies about the birthing process so they can feel prepared. We just started strengthening our relationship with Cleveland Clinic Mercy's labor and delivery. So both the area hospitals will be involved in that partnership. We also have a good partnership with Stark County DJFS. We get a lot of referrals from them, usually women who tested positive in the hospital and baby was removed. So we work really closely with them to develop reunification and explain to mom that just because the baby's not with you right now, that doesn't mean you can't provide support, and show encouragement to your baby that you guys are going to be back together soon because you're in the treatment process.
Sure.
We also have a great relationship with Thrive, an awesome relationship with the Stark County Diaper Bank. We continue to grow relationships in the community and continue to see what can be helpful for all of our moms. The Pregnancy and Parenting Center off of Whipple has been very helpful to us and has a lot of classes that our moms can take that maybe we don't offer.
Sure. You mentioned birthing plans, and quite frankly, I believe most people associate that term birthing plans with a mother who, for example, is going to have an issue in normal childbirth and they have to have a cesarean or something like that. A lot of people don't recognize the term in conjunction with recovery. So what is a birthing plan in regard to recovery?
So we worked really closely with our program and the state to make a safe plan of care. What that means is identifying mom's medications, identifying her most recent drug screens, safe people in her family should that baby need to be removed, that baby could be placed with. As far as the birthing plan, we go through what is mom comfortable with? What is she not comfortable with? Some women, are not comfortable with multiple people being in the room when she gives birth. Some women are not comfortable with having a mirror during birth. So we go through that with them ahead of time and send it to the hospital. So the hospital already knows what their wants and needs are. A lot of women get shy about speaking up for themselves and being able to ask questions and state their needs when they're in that process, but especially in labor. You're in pain. You don't want, you don't want to be a nuisance to people. So it's a lot of times you're not speaking up about your needs. So we're kind of letting the hospitals know ahead of time, these are what our patients' needs are. And we hope that you follow their needs.
Yes. You are the Mom and Me Recovery Program Coordinator. For those who may not know, generally speaking, what is the program and how does someone qualify?
So the Mom and Me Recovery Program was created in 2017. It was a grant that we received through the state, through OMAS, and we get a grant every year to develop maternal fetal outcomes. So those women who struggle with stimulants and opioid use, we want them to have better outcomes for birthing. So if we can get them involved in treatment before they give birth, amazing. After they give birth, good, because a lot of times women relapse after giving birth because the baby's no longer on the inside. Therefore, there's not as much concern. No. So we want to have that support for them so that they know they can continue being a good mom, be in recovery, and focus on themselves. So the program focuses as a support service. It's for women who are pregnant or have a child up to the age of 2. It focuses on women who have use of or a history of use of stimulants, cocaine, or opiates. And the portion of the program that I like the most is we give them this kind of big starter packet, everything a mom's going to need. So we give them a car seat, a pack and play, a stroller, a diaper bag full of items, developmental items, bottles, diapers. We give them all kinds of support things that they're going to need, that starter packet for that every mom needs for their baby. And that's one thing they don't have to worry about. I don't have to worry about getting back to work because I need things for my baby, and I can't focus on my recovery anymore because I have to get a job. So also, as a part of that program, as long as they maintain their involvement in treatment, they can get 25 diapers and 2 packs of wipes a week for their child. Diapers are expensive.
Yes.
And you go through a lot of them. So one of the things we encourage is maintaining that involvement in counseling also has that benefit to it. We also help them with transportation services like Uber, Lyft, bus passes, gas cards. As long as they maintain their involvement in treatment, we're supporting that.
That is absolutely fantastic. And we want to point out that we here as an agency, CommQuest Services, we're about supporting mothers in recovery because that's a segment of the recovery community that obviously has special concerns. With that being said, even if a mother does not specifically meet the criteria for the Mom and Me program, there are still many ways we can support mothers in recovery. Like you said, providing basic baby needs, for example, is still a part of that. We want people in recovery, like you said, to be focusing on their recovery and not a lot of what you might call busy distractions. Can you tell us more about what may be available, even if you don't specifically qualify for the Mom and Me recovery program?
So about 4 years ago, we started the baby community closet. The reason that we started that is because we noticed a lot of our moms still had needs outside of what the Mom and Me recovery program could provide. And we noticed there was a lot of moms that qualified for our recovery services, but necessarily didn't qualify for the grant because of the specifications around it. So what we wanted to do was still create an open environment to still help moms, even dads with young children, up to the age of 2 with baby clothes. We have a great partnership with Enfamil, who provides us sample packets of a formula. So if we have a parent who's struggling with getting that WIC connection, we make sure that they have supplemental formula until they get that point. We give them diapers, we give them wipes, anything that's been donated to us, we provide if we have it. Mm-hmm. So all they have to do is let their counselor know, hey, I have a child under 2. Do you think you could help with A, B, and C? Absolutely. If we have it, we'll help with it.
Mm-hmm. Brooke, I certainly want to thank you for the work that you do. It's absolutely critical, and we really appreciate you stopping by and letting us know about everything that we're doing. Thank you very much.
Thank you.
We have been talking to Brooke Burkett, who is a clinical supervising counselor and the Mom and Me Recovery Program Coordinator. If you would like more information about the things we talked about on today's podcast or more information in general, I would direct you to CommQuest.org. That's CommQuest.org. My name is Bill, and thank you for listening to the CommQuest Hope Discovered podcast.